So one thing that's really stood out for us, I think, over the years that we've been practicing narrative therapy is a really relational kind of identity. And I think what we did in this paper was think about 4 different aspects of that we could illustrate and hopefully bring to light through examples of our work.
And those aspects are that identity is relational, that it's distributed in different places and different people and different contexts in our life, that it's performed, that we are who we act like we are, and we do that in acting with each other, and that identity is fluid, that we're always changing, that it's not a fixed thing.
You kind of set the stage over this like a 30-year span since you were first attracted to, before narrative therapy, first you were attracted to family therapy.
The particular history piece, I think, that motivated me, and I think Jill, in this article was remembering back to the excitement that used to be there. If you went to a family therapy meeting in the early 80s, it was about how everything's interconnected. It was about the politics of family life. And that, as the field got more interested in becoming a professional discipline, and as these other discourses came in from the medical model and way you have to make an individual diagnosis to even get paid.
Right.
The interest on individualization of responsibility for maintenance of your own health care, privatization in the way that goes. That we have lots of conversations with ourselves about how individualistic it's gotten and how the narrative worldview helps us stay out of that, or helps us at least usefully question it.
So how come you decided to write about identity to express what was going on in society?
Well, I think we've always thought about identity as being relational.
Yeah.
In that one case example, Jill, which I think was your, it was a couple, but it was a mother and daughter couple. Yeah. And I thought the idea really came, the contrast between what the psychiatrist was recommending around kind of like this personal empowerment versus relational identity idea, which was expressed more that the daughter was still remembering as the mom was forgetting, and she brought that in, that there was all these values and connections to others and a lived life that really stood in contrast to this small individual person.
Because for me, even though I'm from more of a relational background, but it was hard for me to articulate how the differences between two, and or like even recognize, it's maybe more of a from an individualistic point of view to think about a person. So that contrast was really kind of clear.
It's like having you, Suping, like talk about, even though we think we're thinking relationally, you notice places where the language is more individual, and you've brought that to us, to our group. I guess that when we're thinking about relational identity, we're thinking about people beyond what they're saying in that moment. We're thinking about the many contexts, possibilities. The flow part is really interesting to me, because we're not trying to capture the way somebody's representing themselves at that moment, but we're seeing that as part of something that changes over time. And so that really frees me to think beyond the clock to where else that picture could go. So even if people are thinking about themselves in a pathologizing way, they're making these negative identity conclusions because of something that's happening then. I think some of the ideas that we have about relational identity help me not get caught up in that story, believe that there are other stories, other contexts, other experiences that help me sort of see through that, to ask questions that have people describe a step that's outside of that, that then is a platform for something